The American Cancer Society estimates for 2014 about 12,360 new cases and about 4,020 deaths from cervical cancer. Cervical cancer was once the most common cause of cancer death for women. Most cases are found in women under 50 years old, and in the U.S., Hispanic women are most likely to get cervical cancer. In 2011, there were 12,109 women in the United States that were diagnosed with cervical cancer, and 4,092 women that died. Incidence rates and mortality rates have both declined significantly from the years 2000 to 2010.
Stage 0 cervical cancer is characterized by carcinoma in situ, a malignant lesion where the underlying tissue has not yet been invaded. During stage 1A, the cancer has grown through the underlying tissue of the cervical lining and is now considered an invasive cancer. Stage 1B, the tumor can either be seen with a microscope or without. During stage 2A, the cancer has spread beyond the cervix to the upper 2/3 of the vagina, but not to the tissues around the uterus. Stage 2B, the cancer spreads to the tissues around the uterus. Stage 3A, the tumor spreads to the lower third of the vagina. Stage 3B, the cancer may spread to the pelvic wall or even to the uterus. If the flow of urine is blocked, kidneys can become enlarged or stop working. Stage 4A, the tumor spreads to the bladder and/or rectum. It may also spread to the pelvic lymph nodes. During stage 4B, cancer spreads past pelvic lymph nodes to other places like the liver, intestines, or lungs. Some important risk factors for cervical cancer include the HPV infection, smoking, chlamydia, having multiple long-term pregnancies, a family history of cervical cancer, and ethnicity.
Women with early cervical cancer has no symptoms. As the cancer grows larger, some of these symptoms may appear. Vaginal bleeding, bleeding that occurs after sexual intercourse, bleeding after pelvic exam, bleeding after menopause, also bleeding between periods, and having longer and heavier periods than usual. Women may also notice increased watery bloody discharge. Cervical cancer may cause some pain, such as back pain, pain in pelvic, pain during sex. Problem urinating is a very severe symptom. Women with this symptom should see a doctor immediately. Bone fracture is a typical sign of an advanced cervical cancer. Swollen lymph nodes is another symptom of cervical cancer. Women with any of these symptoms should see a doctor immediately, so cervical cancer can be diagnosed and treated as early as possible.
Here we have some ways to diagnose cervical cancer: Pap smear, pelvic examination, HPV DNA test, and a colposcopy. Ways to treat cervical cancer are as follows: surgery, which removes cancer tissue during procedure; chemotherapy, which shrinks or kills the cancer; radiation using high energy rays to kill the cancer; clinical trials; and complementary and alternative medicine.
Preventative cervical cancer screening should start at age 21 regardless of age of sexual activity. Pap smears should be every 2 years for ages 21 to 29. At age 30, Pap smears can be every 3 years if they are consistently negative. Gardasil vaccine is given in 3 doses to help prevent HPV. The CDC recommends routine vaccination with Gardasil for boys and girls ages 11 and 12. The CDC also recommends vaccination for young women 13 through 26, young men ages 13 to 21 who have not already been vaccinated.